Overhead squat assessment, extensive forward lean compensation. Squat to the depth of an average chair height with your arm raised above the head. Repeat it 5 times. An ideal dynamic posture is that the tibia remains in line with the straight back, while the arms also stay in line with the torso. One common problem with squatting performance is excessive forward lean. Some of the common causes are lack of awareness or impaired neuromuscular control, muscular imbalance that can be A. weak posture chain, or B. tight calf muscles. And another common cause is an ankle joint restriction. Overhead squat assessment, excessive forward lean compensation due to lack of awareness. Solution 1. Using a mirror for extrinsic visual feedback. Use the mirror only for 2 to 3 repetitions. Your goal is to provide athletes with the type, amount, and frequency of extrinsic feedback that forces them to attend to the intrinsic feedback, the feedback they sense themselves. Solution 2. Wall-facing overhead squat. The wall does not allow an extensive forward lean. Overhead squat assessment, extensive forward lean compensation due to tight calf. One of the common problems with squatting performance is a restricted ankle dorsiflexion. As a result of this restriction, the body falls backwards. To prevent the fall, the trainee leans forward. A possible reason for restricted ankle dorsiflexion is overactive or tight calf muscles. There's a strong facial continuity between the plantar fascia and the Achilles tendon. The plantar fascia is tissue on the bottom of the foot that can affect the mobility of the ankle and foot. The possible solution: self-myofascial release and stretches. Self-myofascial release can be a valuable aspect of the soft tissue mobility. Start with the bottom of the foot using a small ball. Move from the bottom of the foot to the posterior lower leg. Use a tennis ball or a foam roller. As previously mentioned, there is continuous myofascial connection from the plantar fascia to the hamstrings. Not only the calves, but the foot and posterior thigh should be included as well. Solution 2. Lengthen the tight muscles via static stretching. Hamstring stretch exercise is one leg on chair, and direct your attention to the top of the head. It is recommended to add to this stretch additional muscles as gastrocnemius and plantar fascia through dorsiflexion and toe extension. You can use the image of a flashlight beam shining forward and upward from the center of the chest bone. To increase the strength, tilt the body forward through the hip joint. Another effective stretch is hamstring stretch facing the wall. Lay your foot on a foam roller. You can also flex your knee. Flexing the knee reduces the tension of the gastrocnemius and increases the involvement of the soleus. Overhead squat assessment, extensive forward lean compensation due to restriction in the ankle joint. To prevent the fall, the trainee leans forward. A possible reason for restricted ankle dorsiflexion is tight joint capsule and/or scar tissue in the ligaments, usually from prior injuries. Tight joint leads to loss of mobility. A common solution for this restriction is ankle mobility exercises. Stand facing a wall. Lunge forward to see if you are able to get your front knee to touch the wall without lifting the heel off the ground. The knee moves forward through the ankle joint, dorsiflexion. A variation for this exercise is self-mobilization of the ankle joint using a band. Place the band across the very bottom of the ankle and over the talus. As the tibia and fibula move forward over the talus, the tubing pulls the talus back, posterior talar glide. Now we should block or pull back the talus, not the tibia or fibula. Variation: the tubing pulls the tibia and fibula into anterior glide. The trainer blocks the talus from moving anteriorly. The result is posterior talar glide and anterior tibia glide. Another variation: push the knee forward and lateral knee out.